Hi, everyone. Thanks for joining today. This is the Global Health Next Generation Seminar series hosted by the Office of Global One Health here at Texas A&M. Our Associate Dean for One Health, Dr. Jerry Parker, couldn't join us this morning due to some other obligations, but he sends his regards and he's excited to watch this after the fact. Let me stop sharing my screen so that we can better see our panelists. Stop sharing. So I want to welcome our panelists, Dr. Amy Delgado and Dr. Ethan Taylor, both Aggie alums. We're so excited to have some Aggies here in the house. Dr. Amy Delgado is the acting director at the Center for Epidemiology and Animal Health at the USDA Animal and Plant Health Inspection Service, Veterinary Services, where she's dedicated over 7 years of her career to ensuring the quality of national animal health data, the practical analysis of that data to inform national preparedness and response for highly contagious animal diseases. She graduated from the CVMBS with her DVM in 2006, followed by a PhD in epidemiology in 2011. Correct me if I'm wrong on any of these dates. I tried to do some research beforehand. Dr. Ethan Taylor is an infectious disease epidemiologist at the Cincinnati Children's Hospital Medical Center, where he works with the STAT lab on the influenza imprint study, along with research involving SARS-CoV-2 and other viral pathogens. He's been involved in 6 different outbreak responses, as well as in other disaster responses, including Hurricane Harvey. And he's advocated for biosecurity and public health preparedness at the Texas and federal levels. Dr. Taylor graduated with his PhD in epidemiology from the CVMBS in 2019, following his MPH at George Washington University in 2016. Did I get all those details right? You guys are very illustrious and have lots of achievements. I want to make sure I got everything right.
Yeah, everything was right on my end.
Okay.
Yep, mine as well.
Awesome. So thank you both so much for being here. Sorry, Dr. Delgado, that we had to reschedule a couple times the earlier iteration of this meeting, but we're glad that we're getting it done finally. So opening question, both of you are epidemiologists by trade, but I imagine this is not what you dreamed of being as a young child. How did you discover the field of epi, and when did you know it would be where you would stay? And just for fun, after you answer that question, what did you want to be when you grew up, when you were a child? Maybe Dr. Delgado, you could go first.
Sure. Well, I do think being an epidemiologist was not my ultimate career goal from a young age. I did always want to be a veterinarian, though. I was very passionate about animals, and so I had, explored a lot of career paths associated with animals when I was young. And as I got up older into high school and even in my undergrad, as I was getting ready for applying to veterinary school and really thinking through those paths, I found myself certainly heavily involved in agriculture. My undergrad and bachelor's and master's degrees are in animal science. And so I spent a lot of time looking at production systems and understanding livestock management and health. And so when I got to vet school, I realized that there were a lot of great things about being a veterinarian, even in large animal practice. But at the same time, I was really interested in population health. I was very interested in a lot of the real world problems that the industry is facing. And I was very interested in international work. I loved having the opportunity to travel and to work in other countries, partnering with official veterinary services and other programs to really focus on the national herd and surveillance and emergency response programs. And so when I started looking at all the things that I would really love to be doing, I realized that just being a veterinarian probably wasn't going to be enough to get me to where I wanted to be. And so I started looking at specializations and graduate programs. And I thought, okay, well, if it really gets me the job I want, I guess I could go into epidemiology. And that's how excited I was about it at the time. But honestly, once I got into the program and I started studying epidemiology, I just fell in love with it. I love the practicality of it. I love being data driven. I was a heavy quantitative epidemiologist, so I am very analytical. And from there, I had the skills and the confidence to launch off and learn a lot of new techniques, whether it was, computer-based simulation modeling, surveillance design, national surveys, and lots of different aspects where my career could grow. And so epidemiology just became a really, really great fit for me, and did open up the doors that I wanted it to.
Awesome. Thank you. Dr. Taylor.
Yeah, so I wanted to be a veterinarian as well when I was younger. My family had adopted a dog that started losing large amounts of hair. And so we ended up taking it to a few different veterinarians and a whole bunch of allergy tests and other things later. Found out it had duodectic mange. So looking back, I guess the path to infectious disease epi was always kind of there for me. But that was what started my interest in vet med. Like most people who aspire to go to vet med, I worked in multiple veterinary settings, from on farms and in clinics, at the zoo, all sorts of great things. And so I would go through different pre-vet days. Ohio State is my home state school. And one of the days that I was there, they had talked about pairing a DVM with a Master's of Public Health degree and how you could work in bioterror prevention or bioterror countermeasures. And so I remember thinking that that was really cool and something that I wanted to consider once I got into vet school. My mentor at the time had a Master's of Science, and he did that when he was in vet school as well. So, fast forward through to my senior semester at Miami in undergrad, finishing up a ZO degree. And I overheard some students talking about epidemiology in this class that they were taking. And so it kind of piqued my interest a little bit, but not enough to really seriously consider it as a career. However, I applied to 2 veterinary schools right out of undergrad. One was Ohio State. I found out the first day of finals week that I was not accepted, which is not the way you want to start finals week, by the way. The other one was Iowa State, and I got waitlisted and eventually wasn't called off the wait list. So I was kind of in this no man's land of, well, vet med was what I always wanted to do. It was what I had prepared myself to do. What do I do from here? And so I knew I had a few different options. My animal and vet experience, all those hours were good. My GPA was a little bit low for undergrad. So I thought I could retake some classes in undergrad, maybe try to get into vet school. Maybe it works, maybe it doesn't, but I'm not really progressing my career anymore if it doesn't. I just retook some classes, got some better grades. So I started looking to epidemiology more. I remember the pre-vet day at Ohio State and thinking that bioterror countermeasures would be something that was really interesting to do. I was in the 4th grade when 9/11 happened. I remember the anthrax letters and all those sorts of things. I've got a family history of serving in the military, so I thought that was my way to be able to serve my country. So I started looking into that more and was really trying to make myself feel better. So I was requesting information from all these different programs, Harvard and just crazy schools, so I could get something in the mail and be like, oh, they want me, kind of that false sense of need. And George Washington University called me like that day. And I didn't answer. I knew nothing about GW at all at the time. So I did some research on them. The person who called me like every week. So I decided to pursue a Master's of Public Health. That way, if I wanted to pursue vet school later on, I could. If not, I was still making progress towards something. It was around that time in 2014 that the Ebola crisis in West Africa started. And from there on, I was hooked on infectious disease epi. I did internships with the Ohio Department of Agriculture in their animal disease diagnostic lab during a Seneca Valley virus outbreak. I worked in infectious disease investigation at Columbus Public Health, also doing Ebola direct active monitoring. And so it was from there that things really started to take off. And I had considered applying to Texas A&M for vet school because one of my mentors at Ohio State was an Aggie vet. And so he always spoke really highly of Texas A&M. And that's how I ended up applying to A&M for my PhD program and then working under Dr. Morgan Scott, doing some work on antimicrobial resistance of enteric pathogens. And here I am now at Cincinnati Children's Hospital. I originally started at Procter & Gamble in post-market safety out of graduate school, but when the pandemic happened, I really wanted to use my background in infectious diseases to be involved in one way or another in the pandemic response. And so now I'm involved in research with influenza and SARS-CoV-2.
Great, thanks. I feel like you both just gave really extensive answers, and so I don't know if any of my questions will be repetitive, but I heard you talk a little bit about mentorship, and this is a big thing in career and professional development. So I'm wondering if you can talk a bit more, if you haven't already started talking about the role of mentorship in your career path and professional development. Dr. Delgado, are you still with us? We may have lost her. Dr. Taylor, why don't you go ahead and we'll try to get her connected again.
Sure. So yeah, for me, mentorship was hugely important. I did a lot of volunteering, a lot of interning, and those sorts of things. And there are a few different people that kind of stood out to me. Right when I graduated from high school, I started interning at the Cincinnati Zoo. And so Dr. Greg Levins there was very supportive of me through wanting to go to veterinary school up until I kind of shifted a focus toward epidemiology and wanting to be engaged in zoonotic disease more from that standpoint. And it was kind of one of those things that, no matter what I came to him expressing I wanted to do, he was there to help me and encourage me in whatever way that he could. As somebody who had applied to veterinary school multiple times himself, he kind of understood what I was going through with that initial rejection and kind of that shock, because when you apply to professional school, you always just assume you're going to get in. For many of us, if you did get rejected your first or second time or however many times, it's your first rejection academically ever. So it kind of came as quite the shock to me. And he was great in terms of kind of keeping my spirits up and continuing to guide me onward. Then during my master's, I had a great professor who, again, was very encouraging. And his course was the first one that I really felt like a public health practitioner, and that he put us in the situation of a hurricane response and says, now, what do you do? You're public health, you're on the ground, nothing is set up. Where do you start? How do you go about that? And at the time, living in Southwest Ohio, I thought, well, that's pretty cool, but I'm never going to be involved in anything regarding a hurricane ever. Fast forward to 2017, and there's Harvey. So his mentorship really helped there quite a bit. Of course, my committee chair, Dr. Scott, he was fantastic. It was my first time ever running a study. So he was there to kind of guide me along the way and really gave me the freedom to be able to make my own decisions and build the study. Again, great. I never really understood statistics at an in-depth level before taking his courses. So it really, I'm not sure how he did it, but somehow he taught it differently than the other 3 or 4 professors I'd had. That really kind of opened things for me. And then Dr. Jerry Parker as well. Wanted to get involved in biosecurity policy and biodefense. I can't think of anybody else to have right there on campus than Dr. Parker. So he was very encouraging, especially as I started trying to get engaged more in the policy realm. I started reaching out to local and federal policymakers. His guidance was great, as long as those of Andrew Nacios, Dr. Christine Blackburn, Leslie Rule over at the Bush School. They were all fantastic in kind of helping me to take my knowledge of infectious disease and begin applying it outside of the hard science realm and more into the policy area.
Great, thanks. I think we're still missing Dr. Delgado, so hopefully she'll just jump back in.
Yeah, can you hear me?
Oh yeah, I can hear you.
Okay, good. I'm gonna turn my video. Well, I'm gonna turn my video off after the next fail. So we're having a huge winter storm move in, and my internet's suddenly getting kind of sketchy, which I know you guys all can sympathize with. Yeah, so similar to Ethan, I think I had wonderful sets of mentors throughout my career. Dr. Stephen Lukefar and Jamie Lorenz at Texas A&M Kingsville in South Texas were really instrumental in helping me understand in international ag development and have opportunities to go overseas and work in Vietnam and ag development and really kind of see on the ground a lot of the practicalities of what it takes to survive and to be successful as an agricultural producer in a third world setting. Dr. Lorenz was also my master's advisor, and so he taught me a lot about research. I worked in the lab for years for him, and it was just a great skill set to acquire. It was also a great way for me to learn that I did not want to work in the lab for the rest of my career, and so it was a great opportunity, and he was a really great research mentor. Just the quality and the ethics that he brought to his work was incredibly valuable for me. When I made it to Texas A&M, at the vet school, Dr. Gail Wagner, who's since retired, was a really great mentor to me. He loved international work. He was really passionate about it. And he was always looking for opportunities. And so I would go and brainstorm with him and just talk about current events and try to get a better perspective and understanding of how the world worked in terms of policy and animal health, who the players were. And he was the one who introduced me to the US Animal Health Association meetings and gave me a chance to go and really see a lot of those discussions and dialogues in action. He facilitated my internship with DEFRA, the Department of Environment, Food and Rural Affairs in the UK, when I was in my PhD. So I got to spend time in the UK looking at their foot and mouth disease response and really gain more of that international perspective. And just, he was just a wonderful, wonderful man and mentor to me. And then when I got into my PhD, certainly my advisors, and we share an advisor. So Morgan Scott was on my PhD committee. He wasn't my chair, but he was there. So I had an opportunity to work with him as well. And he really was great, challenged me in a lot of ways and helped me learn to communicate better, to navigate some of the complexities of differences in opinion in research and project management. Just really a wonderful opportunity. I agree. He's a great teacher. And if you have the chance to take epi methods and statistics from him, highly recommend it. But Bo Norby was my chair, and he was another wonderful mentor who really encouraged me, supported me. We fought about commas all the time. Does this really need a comma? I don't think it does. But just, people who challenge you to be the very best that you can be in your career and to take advantage of the opportunities that come. And so when I was finishing up my PhD, I was working on, the analysis and getting some papers out, and a job opportunity came up with the Inter-American Institute for Cooperation on Agriculture, which is a intergovernmental agency that's headquartered in Costa Rica. And I thought, oh, this is my job. I really want this job. But I wasn't done with my PhD. And so I went and I talked to Bo and I said, look, I really want to apply to this. This is my foot in the door. This is something I really want to do. And he was super supportive. And I made a promise to him that I would get my PhD done. I would do the work, even if I had to do it in Costa Rica. And so his encouragement, his support, even though I know as a PhD advisor, that's the last thing you want to hear, made a huge difference in my career. And so I took the job in Costa Rica. I moved my family down there, and I hauled all my PhD research with me. And it slowed me down a little bit, but I got my PhD done and defended and out the door and published. At the same time, I got to do some really great real world work, working with that agency and surveillance and emergency preparedness and response. And so those kind of people that you find in your life who help you say yes to the right opportunities and help you be brave and open the right doors are invaluable.
That's great. Thank you both for sharing. I'm wondering if either of you play the role as mentor to anyone right now currently, and if that's something that you're open to if folks on this call decide that they want to reach out to you. We'd love to get them in touch with you.
Yeah, well, I'll go first because my mic's still working, so I'll just take advantage. Yeah, no, I do. I love to mentor and work with folks. I do feel like when you're in a mentoring relationship, there's some good guidelines to follow. And so I try to kind of establish those from the beginning about our expectations. And, I consider my mentees to be really in charge of that relationship and know what they want to get out of it. And so if people are interested and they want to connect, you're certainly welcome to reach out and happy to do that. I've got several mentees at the moment. And so I just try to make sure that I can give them all the time and attention that kind of a relationship really needs.
Yeah, I too am big on mentorship. I mean, a lot of the reasons why I am where I am today is because of those individuals who thought highly enough to take me under their wing and, present me with opportunities, introduce me to people, encourage me. I'm not currently mentoring anybody at the moment. I have previously mentored undergraduate students, particularly this past fall at GW, who were, they anticipated their undergraduate year was going to start off a little bit differently. So kind of navigating that jump between high school and undergrad, like by not being on campus was kind of a challenge. So that's kind of the bit of my mentorship so far. But I'm definitely open to it and providing whatever sort of insight or bias perspective that I could for anyone wanting to get involved in epidemiology.
Great, thank you both. So pulling us into more focus on what you're currently doing in your current roles, what are some important projects you're currently working on or ones that you're particularly excited about? Dr. Taylor, do you want to go first this time?
Sure. So we have a lot of different projects ongoing right now. Many of them have to do with COVID in terms of an immune response. So being a pediatric hospital, most of everything that we do focuses on children. So some of our studies were focused on screening children and their caretakers, other people in their home for COVID, kind of monitoring those things, looking at how how immune responses mount due to COVID, how long immune levels stay at their peak and then decrease. Now that we're starting to get some individuals here in Ohio that are being vaccinated, I'm starting to take into consideration some of those variables as well. Also with return studies, looking at people who are working from home for whatever period of time when the pandemic first started and seeing what their immune levels are now. The big study that we have going on is Imprint. Another one similar is Prevail that's wrapping up, but they're influenza studies. And so what we're interested in is mothers are enrolled when they're kind of nearing the end of their term of pregnancy. We collect blood samples and those sorts of things. And then the child is enrolled in the study from birth up until 4 years of age. And so throughout that time, we collect nasal swabs and blood samples and those sorts of things at intermittent periods. And what we're interested in is we're interested to see if first flu exposure, whether that's naturally occurring in the environment or first flu vaccine, how that imprints on the immune system and then impacts subsequent responses to influenza. So for instance, if your first exposure to influenza was H1N1, and then let's say a year or two down the road, you get H3N2, what does your response look like? And so the hope is that through collecting those data across 4 years through the cohorts, we can gain a better understanding of influenza from an immunologic response, and then be able to use those data to eventually develop a more effective influenza vaccine.
Thank you. Dr. Delgado, are you still there?
I hope that I am. Can you hear me?
Yes.
Okay, good. I saw somebody turned off my video, so I'm guessing I froze up. I apologize. Of all the days for my internet to fail, this is the one. But yeah, so we also have a wide variety of projects ongoing at SIA right now. Certainly in the SARS-CoV-2 space, we're involved in a lot of the discussions and concerns around monitoring and surveillance for the SARS-CoV-2 virus in livestock and pets. And so we are one of the focal points for OIE reporting for disease. And so all of the nationally confirmed cases come to SIA, and that's information that we provide to the OIE. We're also providing a lot of support for the mink populations that are affected with SARS-CoV-2 and understanding some of the epidemiology of those situations and possibilities around surveillance and other control measures and risk mitigation for people who are involved in the mink industry. Kind of getting away from a little bit of that, we're also just launched the National Feedlot Survey, Health and Management on US Feedlots. So that just started last week. Those studies are a long time coming in terms of design and planning. And so super exciting to see them rolling out. That study includes a wide variety of issues relevant to the feedlot industry, but maybe relevant to this group. It also includes a lot of information about antimicrobial use and stewardship in feedlot settings. And so we always have a lot of different issues that we're tracking and looking at in our national surveys. We're also doing a lot of work in emergency preparedness. Certainly, many of you know African swine fever has been moving and active around the globe. And so we have a lot of ongoing projects related to preparedness for African swine fever, and then kind of long-standing work in preparedness for foot and mouth disease and avian influenza and other transboundary diseases that show up occasionally in the US or threaten us on a regular basis. So we do everything from disease spread simulation modeling to evaluate control options, to surveillance design and planning for outbreak preparedness. We work a lot with our National Preparedness and Incident Coordination staff to develop the red books for emergency response that you'll find online in the FAD prep materials. And so we're constantly looking at ways to improve those materials and provide updated guidance and support to our state and industry partners who really are on the ground in the middle of a response. And so that's a big part of what we do. Right now, things are a little bit slow because we have a good portion of our staff deployed to support COVID vaccination. And so USDA was asked by FEMA to provide veterinarians and others who could go to vaccine sites for COVID and either administer the vaccine or provide logistical support and planning support for those activities in different states. So I've got quite a large number of my staff out in the field working on that right now, which is just a great example of that One Health aspect that we're all a part of being able to respond and deal with this pandemic.
Yeah, absolutely. I was just going to say both of you really touched on the power of this concept of One Health. I feel like when we talk about One Health, we think about, ways that we can cross collaborate, but we don't often get to hear kind of on the ground experiences. Rather, we hear more about the academic collaborations in academia, but it's really nice to hear how you both are responding to really present day issues, especially this pandemic. So thanks for those answers. Let's see. What have you found? This is sort of a general question, but what have you found to be the biggest challenge in the work that you do every day? It can be interpersonal or operational, whatever sparks for you there.
Well, for me, the big jump is going from animal research to human research. And so one of the great things about epidemiology is, the statistical principles, they don't really change any. However, I came from, cows in pens. The cows never left the pens. They're all fed the same thing, and their husbandry, for the most part, is all the same thing, unless you kind of look at differences between farm. But coming from that into doing more of human research where people move all the time. People eat different things, different socioeconomic statuses, everything is different essentially. Trying to learn to control for many more factors than I was used to previously has been kind of the biggest challenge for me. And kind of being able to take what I learned through my PhD and then be able to apply it in these sorts of areas has been a little bit of there's been some growing pains there a little bit, for sure.
Yeah, I think for me, some of the biggest challenges have been around understanding and navigating the space between science and policy and politics, which are not the same thing. And it's a complicated space to work, but it's also incredibly rewarding. It's where science has the chance to influence decisions and provide input into what our government does and how it does it. And so it's a really rewarding, exciting place to be working. Sometimes it can be frustrating too. Sometimes we miss the mark with our science. We don't get it there in time to meet the window for a decision. We make it too complicated and decision makers aren't able to really take advantage of it. There's a lot of things that you learn as you work in that space of kind of hitting that sweet spot of providing scientific support for decision making. And I think it just comes with time and experience and working on those types of projects and engaging with people who are decision makers, policymakers, politicians, and hearing and really understanding what pressures they're dealing with, what they're navigating, and then bringing your best science to the table in the right way at the right time. And so for me, that's been a learning curve, but certainly a very rewarding experience.
Thanks. Yeah, it sounds like you both have had quite a bit of experience translating science into policy. I'm curious about whether you think that it's kind of the duty of those involved in this type of research, especially epi, and especially gathering information about infectious diseases. Do you feel like it's kind of inherent to what you do to help educate the public, or do you think that that's something that is more dependent on your personal skill set? Or yeah, I'll leave it at that. What are your thoughts?
For me, I feel a sense of responsibility for it. Having a public health background, especially epidemiology. I mean, the reason why we talk about John Snow and other epidemiologists is because he removed the pump handle. You have to have some sort of intervention with epidemiology, and I kind of feel that with science in general, we're making these great discoveries, but if you don't communicate those, if people don't understand what you're doing, then it can mean nothing. I tell people all the time, you could have a cure for all the cancers that you want to, all the different subtypes and specialties, and for all of it. But if you can't communicate that effectively, nobody's going to know. It's not going to do anything. There's not going to be a betterment. With that said, it's very uncomfortable for scientists at times to do that because you're trained to speak essentially a foreign language. Science is very different than communicating in normal everyday conversations. And so some scientists kind of feel uncomfortable with that, or it's easy to get frustrated a little bit. Like I make the mistake oftentimes of thinking that, well, because I'm studying SARS-CoV-2 or influenza or whatever, that it's something simple. I forget that I work with it every day, so I need to communicate it in a different way to make it more digestible. Oftentimes scientists write for scientists. If you pick up a scientific journal, it's hard for somebody without that scientific background to read it and understand it. Even as a scientist, for me to pick up a journal that has a different focus. So if I went from, what I publish in now and I pick up a cell bio journal or, some other scientific focus, it's going to be very difficult for me to pick it up and understand it at any meaningful level. And so from a public health perspective, and you can kind of see that through what we've observed in the pandemic with things that Dr. Fauci's had to endure and others in science, that it's so important to be able to communicate those things effectively and why we're doing our decisions and how we come to those decisions. Most everybody in the United States is familiar with football. And so after halftime, oftentimes the coach changes the game plan, or if they're a good coach, they change the game plan. And nobody ever goes, well, we shouldn't be doing that. But with science, people have this misunderstanding that you do a study and you automatically understand everything. Nothing changes. You don't learn more details. And so people need to understand that the scientific method is in and of itself different than what you learn in school through high school and even early undergrad, where they teach you everything is just a fact. This is a fact, that's a fact, this is a fact. When science is very fluid, what's a fact today might not be a fact tomorrow. Things change, especially with a novel coronavirus. You learn something new every day. So what we recommended in March of 2020 wasn't what we recommended in August 2020, December 2020, because we're constantly learning, the virus is constantly changing. And the general public doesn't really understand that. And so when we make changes in our policy recommendations, it looks like we don't know what we're doing or we're making stuff up, when that's not really the case. It's the perception.
Yeah, those are great points, Ethan. And I guess I'll just kind of dovetail with that. I do think, so in my role within the government, we sometimes don't always have opportunities to communicate directly. Certainly we publish and we try to put our work out there, but a lot of times what we're doing is influencing other parts of the government who are working on actions, activities, policies, guidance, all of those spaces. And so what I've learned in a few years of banging my head against it is that the best work happens in places where you're in partnership as a scientist with those decision makers. And so a lot of times we come with our very best, bright and shiny science, best answers we've got. And they say, well, that's great and all, but here's really the reality we're facing. Here's the pressures we're under. These are the financial constraints. These are the political issues we're trying to navigate. Here's this giant, large picture of racial equity that we're also trying to balance and think through. And suddenly your science seems really small. And you're like, well, okay, I didn't actually address all of those things in my science. But at the same time, if you stay and you listen and you partner with them, you can find ways to build feedback loops in that say, I hear what you're saying. Let me go back and look at the data and help you understand how the choices you're making or the decisions you're considering might play out. Here's what we know, given what we can see and what we can measure. And so it becomes a really great dialogue to help them hone in on the right strategy, the right policy, and understand what the impacts of their policy are. Sometimes they don't change their mind, but you can at least say, just so you know, this is where we might be seeing some disproportionate impacts. Here's where we might be running into some issues with, we don't understand virus inactivation. We don't understand how composting, poultry carcasses is actually going to play out in the real world. And then we can go back and reach into researchers with Ag Research Service or with university partners and start to fill in those gaps for them. And then the next time we come back with our science, it's even better. We've got some more information on hand to improve those decisions. So I think for me, communication is really about partnership. It has to be a two-way street. It has to be really respectful. We do great work. I love the work that happens at SIA, but I also recognize that our partners are also doing great work and they're wrestling with big questions and big problems. And so just coming into it with that mindset really sets you up for success.
Thank you for those thoughtful answers. Yeah, I really appreciate the fact that no matter how many degrees and how much scientific data we can throw at problems, sometimes it really just comes down to these interpersonal skills and developing communication skills and being able to respect folks coming from different backgrounds and with different mindsets. So thank you for that. I think that I will ask one more question and then give some time to the audience to type their questions in the chat so that we can address some of their questions. This one's just a fun one. Is there a book or a podcast or a blog that you would recommend to this audience? Something that's really been kind of sparking your brain, getting you excited, helping you see things from a different perspective? Yeah, go ahead.
So one of the first epi books I bought was 11 Blue Men, and essentially it was written by a medical journalist from like the early 1900s, I believe. And it's all these different outbreaks that had occurred and their research of them and kind of their interviews and those sorts of things. But the one for this group particularly, I love Spillover. I believe David Quammen is the author of it. And it's about HIV and SARS-CoV-1 now, and other zoonotic diseases and their first cases and how they were developed, how they spread, and kind of that sort of investigative background. They're definitely books that I like. They're books I like to read on airplanes because they're kind of conversation starters as well. But Spillover is a fantastic book. I would highly recommend it.
Yeah, this is a dangerous question for me because I love books, love them. And I'm an avid reader. And so I'll just recommend two that I've just recently been working through. And the first is a book called Upstream, and it's authored by Dan Heath, checking out my bookcase. Fabulous book. If you really want to think about how do we make a difference in public health and animal health, how do we start working upstream of a problem to really manage and mitigate impacts? It's a fabulous read. It's not difficult, but it's very challenging. The way that it pushes you to think about what you're measuring, think about the possible unintended consequences of policies and actions, but also the power of a small group of really dedicated people who tackle a problem and who persist and work hard in the space. Really encouraging book. I enjoyed it. My entire leadership team worked through it together recently, and just a lot of great conversations came from doing that book together. The other book I'll recommend is kind of more of a personal book that I think if you're interested in improving your soft skills, there's a book called Thanks for the Feedback. And the subtitle is it's called The Science and Art of Receiving Feedback Well, Even When It's Off Base, Unfair, Poorly Delivered, and Frankly, You're Not in the Mood. And so if you've, like me, struggle with giving, very good feedback, or if you find yourself only focusing on the negative, or getting kind of caught up in that internal dialogue when you get feedback, it's a great book to kind of help you get out of that space, start thinking about feedback differently, and using it to your advantage in your career and in your personal life. So that book is by Douglas Stone and Sheila Heen.
These are great recommendations. I'm gonna make a list for myself after this and go pick them up. So we do have one question in the chat from Daphne Lowe. Do you think that you need a master's to get your foot in the field, or is it possible to go in with just a bachelor's? Either one of you, feel free.
So my first experiences in epi weren't until I started my master's program. I know a lot of places kind of view having a MS in epi or a master's of public health as kind of entry level for those positions. Although if you're looking at more local or county level public health positions, not quite as much, although you'll find some that only require a bachelor's. I think now with everything going on with COVID, if you're interested in kind of seeing if epidemiology is right for you, or just kind of wanting to gain some experience in that, a lot of contact tracing type positions only require a bachelor's. And so a lot of public health agencies are really strapped right now. Public health is traditionally underfunded. Typically they're kept at like a skeleton crew. And so just even kind of volunteering and building your experience that way is going to help if you only have a bachelor's degree or you don't want to go any further. Kind of getting those experiences might help you stand out a little bit more.
Yeah, so glad, I do think it depends on the type of work that you want to do. So as Ethan mentioned, there's a lot of very field-based work that you can get into with a bachelor's, tracing, some of the survey work, those types of activities. And so it's a great chance to just get plugged in and connect and meet people, see how things go at a field level. I think as you want to move up, and if you want to get into analytics, or if you want to be involved in some of the other complicated aspects of epidemiology, an advanced degree is really helpful. And so we found that for at least with our center, sometimes people come in with a master's in public health and they maybe shied away from the analytics, they shied away from some of the data pieces, and they really struggle. A lot of times we have to send them back to school to get those skill sets, right? So if you're afraid of data, if you're afraid of statistics, I would just say lean into that, work hard at it, spend some time, and it will pay off, even in your undergrad. So those are some of those skill sets that are a little bit intimidating at first, but in the real world, they are very practical. They can be very doable, very hands-on and manageable, but you have to have those foundations. And so when I talk to a lot of students that are interested in this type of a career path, I really encourage them to consider an advanced degree, to not be afraid of analytical work and statistics. You don't have to love it, but you do have to know and have a solid foundation to get you where you want to go. And if you're like, that's not for me, that's really not what I want to do, that's okay. There are plenty of other types of jobs where it's in the field, it's hands-on, it's working with people and animals. It's just sort of a different experience and a different part of the job. So I think there's lots of opportunities, and it's kind of finding what matches your interests.
Thanks. We have another question. What are some of the first steps in searching for a One Health career and/or experience? I'm really interested in moving to Puerto Rico and finding something there. That's from Vivian Lopez.
I'm still looking for my ideal mixture of, field epi research and kind of mix of a true One Health approach. I've always been I've focused on zoonotic diseases, but it's either been strictly in the animal realm, strictly in the human realm. And I'm really trying to build something that'll blend those. But in terms of first steps, if I had an idea, I reached out to anybody and everybody until somebody said yes. When I was doing my internships for my master's, they were required, but you had the flexibility to go wherever you wanted to. And so I would email and apply. It had to be 60, 65, 70 different places, I'm sure. And some places email you back, some don't, some you have phone conversations with, they don't work out. And out of all those emails and applications, I had like 4 different offers and I took 2 of them. So really just be persistent. I tell people don't be the first person to tell yourself no. If you have an idea or something that you want to do, your job is to look at all the reasons it's going to be successful. Let somebody else worry about telling you no. So just reach out to people, especially if you're a student. People love hearing from students. I think oftentimes when you're in a career for such a long time, you begin to kind of lose sight of your passion for it. It becomes more of a job. And so people love hearing from students because students they're excited, they're green, they want to get their feet wet, they want to learn. And so even if it's as simple as reaching out to somebody and saying, hey, I found your profile on LinkedIn, or I found you on your company's website. I think what you do is really cool. And I'm interested in how did you get here? What steps did you take? And those things really helps. And even if somebody doesn't have an opportunity, they might know somebody who is looking for someone to help out in the space that in which you're interested. So my advice would be just apply anywhere and everywhere that has something to do with what you're interested in. Email people who do that and say, this is my background. This is what I'm interested in doing. Do you have a position? Do you need any sort of help? Even if it's just volunteering to start out, you're still building that relationship. And then later on, again, something may come open. Maybe a colleague of theirs mentions that they need somebody that works in that space. And because you built those relationships, that individual now trusts you enough to recommend you to someone else that could lead to an opportunity for you.
Thanks, Dr. Taylor.
Yeah, I will certainly second the importance of networking and building out those connections. I think it can make a big difference when you're hunting for a job. Unfortunately, I feel like in a lot of the One Health space, and particularly in veterinary epidemiology, the careers, the jobs, the announcements are scattered. They live in lots of places. And so, knowing somebody who knows about those spaces can be really beneficial. For government jobs, USA Jobs is the official website for all government jobs. And so if you've never gone to USA Jobs and looked at it, strongly recommend that you do it. If you're at all interested in government careers, I recommend setting up your profile and spending some time. And it does take a while. Government CVs have a very specific structure, the way that they have to be designed, what information has to be contained. So waiting until, a couple hours before an announcement closes is not the time you want to discover that your CV is not formatted correctly. So do it in advance, spend the time, get it right, make sure you check all those boxes, read your announcements really carefully, and make sure that you're meeting the things that they're asking about, and you're highlighting the experience that's relevant to that position. They do have positions by location. So if you're specifically interested in Puerto Rico, Veterinary Services has an office in Puerto Rico, for example. They would hire, different folks into that setting, and those jobs would all be on USA Jobs. Obviously getting to know somebody on the ground where you want to be. So if you have family in Puerto Rico, if you don't know anybody in Puerto Rico and you're like, I just want to go there, building your network is going to be really important to understand what opportunities they are. And I would say, don't be afraid to take some stepping stones along the way. There's a lot of great programs that help you get the foot in the door. CDC has different internship opportunities. They do a great job at kind of reaching out and trying to share that information online and in different, well, it used to be in-person events. Who knows what it is now? But there's good opportunities there as well. And so sometimes what you'll find is you get into an agency or you get in with a group, and then before you know it, the opportunities come that let you move where you want to be. So stay flexible. I think if you hold out and you're like, but my one perfect job is going to be in this location doing this one thing, you might be waiting a long time before that opportunity appears. So take the chances that come and let yourself learn and grow and stay flexible. And I think you can kind of work your way back around to the location and the job that you want to have. And you may find along the way that what you thought was the perfect job isn't anymore. You've learned and grown, and now the new perfect job is something else. So definitely stay flexible. Definitely get on USA Jobs if you're interested in those types of jobs, and get your stuff set up, get your transcripts loaded, all of those things that just take time, and be prepared. So when the right opportunity comes, you can pounce. I will say that some of the places that are great for job hunting, I think it's University of Minnesota actually has a really interesting job board kind of buried within their website for public health. And so it's a good place to go and look for jobs. Again, USA Jobs, CDC websites, I think are also really good. And then your state agencies. So State Department of Ag, State Department of Health will have really nice job listings, and they're usually really clear about what they're looking for and what the requirements are. So those are good places to start kind of hunting. So State of Puerto Rico, great place to go and look at what jobs that they might have and where things are going. Don't be afraid of temporary positions. That's how you build connections and people get to know you. I'll stop there, and we're on time.
Thank you both. All right, one final question here in the chat. Having a background in wildlife research management, focusing on cervid predator-prey dynamics, and now pursuing a master's in wildlife with a thesis regarding the interaction of wildlife and public health, what career opportunities are out there focusing on the wildlife, livestock, and the wildlife-human health interface?
Just real quick to piggyback off the last question, the job I hold currently wasn't posted. I emailed somebody and was like, hey, I see you do this sort of research. I'm interested. I love infectious diseases. Do you need an epidemiologist? So just another little food for thought thing. Just because a job isn't posted doesn't mean it doesn't exist. The current question, Dr. Delgado might be more suited to talk about this than I am. But I would imagine that there's got to be some sort of opportunity someplace. I mean, so many of our emerging diseases are zoonotic. The human population continues to explode. We continue to expand into previously uninhabited regions. So the battle between livestock and predators have been going on for forever. So I've got to imagine that there's some sort of opportunities there. Having not being engaged directly in that sort of area, I'm not really certain of what those may be, but I think Dr. Delgado or even Dr. Hamer, I know she does a lot of research with wildlife. They might have something better to add than I can.
Yeah, well, it's an interesting space. And it's one of those things that, again, I think you have to be really flexible. So there aren't a ton of wildlife biologists, wildlife ecologist type positions in government agencies, for example. There are certainly within APHIS, the Animal Plant Health Inspection Service, we have an entire division called Wildlife Services, and they hire people with experience in wildlife management, ecology, some of those aspects. That work tends to be a lot on mitigating the impacts of wildlife on humans. And so it's everything from how do you keep birds off of runways so they don't trash airplanes to how do we prevent rabies transmission and in urban settings. And so it's a really diverse, interesting set of work that they do that kind of spans research to policy and guidance and action. They do have field folks who go out and help us with epi investigations. So in several of the recent avian influenza outbreaks, for example, we would call up wildlife services and they would deploy a rapid response team to come out and sample wild birds and other wild species around infected poultry farms so we could try to better understand some of the transmission dynamics in those settings. So it is really an interesting and diverse career set. Certainly the Forest Service, trying to think of the other groups that hire people in that space. There's a lot of GIS related divisions within the government that will hire for people working in that kind of wildlife, livestock interface or wildlife human interface. And we've partnered with them looking at, transmission risk and different modeling approaches. So I every time somebody tells me like, I really want to work in wildlife, a part of me inside is like, okay, take a deep breath and be encouraging. It is a hard path. There are opportunities, but they're hard to come by, and oftentimes they don't pay well. So I just want to be really transparent upfront, but it is a very rewarding work. And so if that's something you're passionate about and you're interested in, I strongly encourage you to pursue it and to be persistent, but also to be flexible. So we hire veterinary epidemiologists who have an interest in wildlife. And so maybe part of the time they're working on livestock diseases. But we just recently had a huge outbreak of rabbit hemorrhagic disease virus in wild rabbits. So for example, that gave them a chance to kind of dive off and really work at this wildlife livestock interface, trying to understand some of these things between wild and domestic rabbits and transmission pathways and get involved in that response. And so, and certainly we work in chronic wasting disease in deer and epizootic hemorrhagic disease in deer. There's lots of opportunities to get involved. So stay persistent and stay flexible, and you can find a path forward. and set up your profile on USA Jobs.
It looks like we might be losing folks to class time, so we can wrap it up here. I really, really want to take the time to thank you both, Dr. Taylor, Dr. Delgado. We know how busy you both are, and we're just so happy that you took the time to talk to all of us about your career path, also what you're currently doing. I know that this is a really valuable this has been a really valuable time spent. So thank you so much. We hope to have you back again. If you have any parting words, feel free to say those now, or also feel free to just leave it where it is. Thank you so, so much. And everyone, hope you have a good week.
I mean, if anybody's interested in reaching out, I'm on LinkedIn. Erica has my contact information, my email, and that sort of thing. So feel free to reach out if you have any more questions or any more interests.
Yep, I will second that as well. It's been a pleasure, and appreciate you guys being interested in this as a career path. We need great people, so stick with it. There's lots of great work ahead.
Thanks so much. Take care, everyone. Have a great rest of your week.